My name is Jose Avalos. I grew up here in Denver, Colorado. I remember there was a time when I was in middle school that I ended up getting really, really sick. It turns out I had appendicitis. My parents had a little bit of a panic attack, mainly because when you hear that in our community in Mexico, and where you usually don't have access to good health care, it's usually related to a death sentence. It's something that should cause concern and fear. So when they heard it here and they didn't know what to do, they were really scared of what was going to happen to me. We didn't really have access to health care, and we went to a different clinic that really didn't provide the best care for me in that sense. So when we went, they told us it was food poisoning, it would go away, just wait it out a few weeks. And eventually it didn't go away, it only got worse, and eventually got so bad that the appendix burst within me. So I remember waking up one day at night, screaming, crying, really, really scared, in pain. My parents terrified. They ended up calling the ambulance. They took me to a hospital, and they told us it was appendicitis. I was the main source of communication between my mom and the doctor serving us. And if I'm the one in pain, right, I can't really communicate my mom's fears and worries correctly, especially at such a young age. I tried my best to express my mom's concerns and in a way like the doctor understood them, but at the end of the day, what we wanted out of that visit didn't happen. When we heard of Tepeyac, we really heard it from a lot of other families who were struggling but found a community within Tepeyac. And when they felt safe and when they felt they could trust this community here, they spread the word. And we were just one of the people who heard. It was really at Tepeyac where, for the first time, we felt like we were heard, and we felt that, there was a community and a home there to be built, and one that would really support, my day-to-day life. I'm entering my third year of college at Harvard University. Currently, I'm studying sociology with a big focus in public health. I'm a firm believer of giving back to the community that helped me grow up. Tepeyac was a foundational step for me and my family in feeling secure and at home within Colorado. It gave us a sense of safety when other places just really couldn't communicate with us that well. When I went to school and I went to college, I left my community, and that was really hard for me. So this summer, I entered Tepeyac, and so far, it's been rejuvenating. Public health is often the foundation for many other things that the community needs. If public health is taken care of and they have a safe and secure place to get out their worries or be treated or find a way to just feel healthy again, they would thrive in many other different areas. There's really limited resources, especially in the community here. So it's really important to me that Tepeyac stepped in and found their place and role within our community.